In this assessment, we'll be inspecting the ears. I will start by inspecting the external ear for size, shape, and position. If I can have you look at me, please. The ears are equal in size bilaterally. The shape is appropriate. And the position, they are in line with the corner of the eyes. Next, I will inspect the auricle and tragus. The skin is smooth. There are no lesions nor abnormalities, no lumps or nodules, and no discharge present. Next, I will palpate the auricle and mastoid process. So palpating the auricle, no tenderness noted nor swelling. No tenderness or swelling noted. Also the mastoid process for tenderness and swelling. No abnormalities noted. Next, I will inspect the external auditory canal using my otoscope. I'm just going to look and inspect for redness, discharge, swelling. No abnormalities noted. I will check bilaterally for redness, swelling, and discharge. No abnormalities noted. Next, I will inspect the tympanic membrane. The tympanic membrane is shiny and pearly. No redness, no bulging, no swelling or discharge noted. The tympanic membrane is shiny and pearly. No redness, no bulging, no swelling, no discharge noted. No abnormalities found. Next, I will test the cranial nerve 8. Vestibulocochlear. I'll have the patient stand at least 2 feet away. I'm going to whisper a word, and I should have the patient verbalize the word back to me.
Football.
The patient was able to verbalize the word football, so no abnormalities noted. While the patient is standing, I'm also going to perform the Romberg test, which is going to test for equilibrium. I'll have the patient stand with their feet together, arms by their side. I'm going to have the patient close their eyes. Okay. No swaying was noted. Minimal to no swaying is appropriate. Abnormality would be that the patient is not able to maintain their balance. No abnormalities noted. The next test is going to be the Weber's test and Rhine test. Using a tuning fork, I'll perform the Weber's test. I would strike the tuning fork on the palm of my hand, place it center of the cranium, and have the patient verbalize that they can hear the vibrations bilaterally. Normal finding is the patient can hear the vibrations bilaterally and equally. The next test is the Rhine's test. I will strike the tuning fork onto the palm of my hand and place it on the mastoid process. Have the patient verbalize when they can no longer hear the sound. The next step is to strike the tuning fork on the palm of your hand and place it at the auditory canal, and have the patient verbalize when they can no longer hear the sound. The patient should be able to hear the air conduction sound longer than they can the bone conduction. I would also do this bilaterally. Turn here forward, please. So I'm going to strike, place it on the mastoid process, and have the patient verbalize when they can no longer hear the sound. Then I would do it again in front of the ear canal, and the patient should be able to hear the air conduction longer than the bone conduction.